So I'm gonna perform an inline aerosol. So with this, make sure we check the patient's chart, make sure we gather all the supplies that we need, especially with the medication, or else the medication might be inside the patient's room. Make sure we wash our hands, apply appropriate PPE, and then once we're about to go inside, of course, we always greet the patient, despite them, some of them, most of them, unconscious, or even if there are relatives present. And then make sure we check the ID band for confirmatory purposes, reassess the patient, try to check their vital signs such as the RR, heart rate, SpO2, and then make sure we auscultate at all times, and then take note also for secretions. If there are any secretions present, we can try to suction it first, and take note also with the ET tube if it's in place and what's the appropriate lip level. So moving on with those, we can proceed with the inline aerosol. So with this, the inline aerosol, make sure we have this T adapter with us, or some hospitals, depending on the policy, they might try to be already being built in the circuit. So with this, if we want to hook it up with the patient circuit, make sure we put this one on the inspiratory side. So assuming this, because this is a single circuit, so of course this is a inspiratory side, we should always put it in here. Make sure it's all secured and tight, not loosen up. And then with this cord, sure it's being hooked up on the side, and then it's also secured. When we put this one on the patient, make sure the ventilator is ongoing. And then once you have this treatment, make sure you position it upright, not in the sideways or even downwards. So the reason is we want to give adequate mist medication to the patient. And then take note also for those parameters such as the minute ventilation or tidal volume while giving treatment, because it will probably increase for a while. And then once you want to start it up with the medication inside, all we have to do is press this button, and then we can see a green colored thing, so it's already been started up. We can also try to listen the medication cap. There's a hissing sound, so that means there's a medication that's ongoing. So another important thing to note is if giving a treatment with the HME, assuming this blue is the HME, if we want to give treatments, so all we have to do is remove the HME and then replace it with the T adapter, or for the nebulization treatment. The reason why we remove the HME is because if we have the HME in place while giving treatment, it would lead the medication to stick on the filter of the HME, so it will lead no benefit to the patient. And then once you're all done, of course, make sure you remove the nebulization T adapter, replace back and put back the HME, like that. And then, for example, if you're already giving treatment, and then once you're all done, all you have to do is press the button and we're all done. And then another important thing to note is once you're all set, double check the connections. If it's secured, there's no misconnections and everything. Listen to the breath sounds post, and then take note if there's still adventitious breath sounds, because the patient secretions are being loosened up. Make sure we always suction the patient, remove all those secretions from the airway, and then take note the vital signs such as the SpO2, heart rate, if it improves after doing treatment in the suctioning part. Reposition the patient if possible. Take note also the lip level. And then once we're all set and ready, remove the PPE, wash our hands. Once we're on the nurse station, chart everything what we did to the patient, explain to the nurse, and then if the physician is present, we can as well tell and explain it to them.